Thank you so much. Good afternoon, everyone. And I'm addressing here the oral health profession. I have decided to come online to deal with a few things around the vaccination process. I've got some few announcements to make as well. So let me start with the quick ones. I have my team here today. It's not the full Menko. You will see I've got Mr. Pankaj Gavin, who is head of legal and governance. I've got Dr. Metzing, who is head of professional development. And one addition that many of you may have not dealt with her as yet is Dr. Tinesha Pabu, who has joined us as head of clinical support services. This was the position that was previously held by Dr. Naranjan, and we then appointed Dr. Michelson to assist while we were looking for the replacement. I'm very excited to have Dr. Pabu, and Dr. Pabu, again, welcome. For us, she has already become part and parcel of the furniture. So again, thank you so much. I think there was no day where you came in and it looked like it was just fun. You know, it was fun, but you had to start running right from the beginning. There's no crawling here. There's no learning how to walk. You don't even walk, you run. Anyway, so there is Dr. Pabu Tinesha, a very, very passionate member of my team in terms of assisting members and fighting for members. So I'm expecting wonderful things to happen. Today, mainly, I want to deal with the vaccination process. So the first announcement that I want to make is that you are aware that last week we got an opportunity to have about 200 dentists that are based or were in Johannesburg or Gauteng to be vaccinated at Steve Biko Hospital, Academic Hospital. It went very, very well. Thank you for those people that responded to our call, gave us the information, and also presented themselves with the right documentation at Steve Biko Hospital. Dr. Metzing and Dr. Pabu were there to assist members, and the feedback has been phenomenal. So thank you very much for assisting us in that regard. Today, we would like to announce to you a further good news in that we have been allocated a sizable number of vaccinations that is coming with the next tranche of the Johnson & Johnson vaccines. This is to occur next week. This time around, it is for all provinces. It's for all provinces, and it's specifically for the dentists. So if you're a practicing dentist, you have an opportunity to be vaccinated sometime next week. At this stage, I do not know, or we do not know what date, what time. But what we do know is that it's going to be a much, much larger number. I know that in the SMS we said 3,000, that 3,000, please remove it and just know that it's going to be a sizable number. We do apologize at the time. That's what we thought we will give you, but that number is no longer applicable, but it will be a huge number nonetheless. It's only for dentists. So whether you're a GP or a specialist, you qualify for this. But you need to register yourself on the V4HCW portal, which we will have communicated to you via the Sadarite. So please ensure that if you have not yet received the Sadarite, make sure you receive the Sadarite, which left my desk about 10 minutes ago. Critical, important information that's in there. So it doesn't matter whether you have registered with the first mobile web unit and you've or website, or you've done with Discovery, or you've done with the government portal. For you to qualify for this particular special dispensation, you need to register on the portal that we have given you and the link, and follow the steps that we have given you. Now, I can already hear many asking, what about our oral hygienists? What about our therapists? What about our dental assistants? They are not provided for in this particular dispensation. This does not mean that they will not be provided for in the future. However, even if it does not happen in the near future, what you should know is that when we do get to the formal vaccination rollout, all healthcare workers and all the people that are working with them, they will be vaccinated. So all of you will be vaccinated nonetheless. And I think that's important. Maybe I should hold back here a little bit and ask Dr. Metin to explain to you the difference of the current process versus the formal rollout process. Dr. Metin.
Thank you very much, Casey. Now, I have emphasized with many members that I have interacted with that it's important to realize that at this stage, we are still at the trial phase. The government had announced a phased rollout program earlier in the year when we started speaking about vaccines. Now, we are not at that stage yet. The vaccine in the country has not been approved yet. So for SAHPRA to approve the vaccine, it needs a sample of about 500 subjects so that they can get the results and approve the vaccine. So where we are right now is at the trial stage. So it's important for members to realize that even if your dental assistants and your oral hygienists and therapists are part of the health professions team, they may not be selected at this stage, but we are still working hard to make sure that they also become part of the trial. But it is important, very important to realize that this is not the actual phased rollout program that the government had highlighted. At that stage, as Casey has indicated, all healthcare workers in the country will be vaccinated during phase 1. Okay. Thank you, Casey.
So let us emphasize the current vaccinations that you are seeing around the country are not of the official rollout vaccine process. These are the extended trial of the Johnson & Johnson vaccine, which means whether you get the vaccine now during the trial or not, you will still be vaccinated nonetheless before the end of phase 1, which is meant for healthcare workers. That is where every healthcare worker or around healthcare workers will be vaccinated before it is extended for the public, which is phase 2 and then phase 3. Critically important, because I've heard so many of our members saying that suddenly to ensure that all of the people are vaccinated. Also, you must also understand is that currently what the government is receiving is not enough to cover all healthcare workers. So it is also unfair for members to expect that all the dentists may have been or should have been vaccinated with the 80,000 vaccines that were given in the first tranche. And yes, I understand, and I hear you, and I agree with you. When you cry foul, when you see a general worker, maybe a cleaner, maybe someone who has got nothing to do with COVID patient receiving a vaccine during this time. Now, those are the things that the government is also dealing with, because quite honestly, everyone is learning as we go along. But we have your back, and we've got people in various committees that we are working with, very, very passionate about what we're doing. And I would mention one of them being Dr. Daniel Shepherd. Very, very good man, and he's doing all our bidding for us. We have regular meetings 3 to 4 times a day, and he is really trying his best. And please note that we are trying our best. Do not, therefore, go on social media and berate SADA without understanding the process. This process, it is just an extended trial. Thank you so much, Dr. Metin. Maybe at this stage, before we go into what you need to do. No, maybe we should go. What is it that members need to do to take advantage of the vaccination for dentists next week? And I'm going to ask. I'll start with you, Dr. Metsing. Just say what you can say. Dr. Pabu, you'll be next, and Mr. Gavin, you will be next. Just to indicate some of the things that members need to be aware. It's what they need to do. Just maybe one point, Dr. Metsing, and then we can go around the table. Before you do that, maybe my first point will be, for you to take advantage of this particular process, you must register on the portal that we have given you, which is V for healthcare workers, V4HCW. It's on the satellite that we have sent. Please forward that satellite to your colleagues as well. And this, by the way, it doesn't matter whether you're a SADA member or a non-SADA member. It is for all dentists in the country. So you can forward that satellite to all of your members. It's so important for us that we are going to ensure that all our dentists in the country receive the vaccination in due course. So even if you have registered on all the other portals, you must register for this for you to qualify for next week. This portal does not replace the government portal. That you must still keep your details there, keep them updated if you have to. And if you have not registered on the government portal, please do register, because there will be further communication coming from that particular portal. So it's important that you have registered on the government portal, but for this particular process and dispensation, you need to register on the portal that we have sent to you. Dr. Metsing, what would be another advice that you will give to the members to take advantage of this dispensation?
Thank you, Casey. It is important as well to ensure that you are a dentist that is registered in the country, because a check will be done with the HPCSA to ensure that whichever details you have put into the system are actually correlating with what is captured at the HPCSA. Dr. Pabu is going to speak about the issue of the vouchers. So, but I just want to emphasize, if you do have a voucher, please put it in. Dr. Pabu?
Before Dr. Pabu speaks, so something very important on what you've just said, Dr. Metsing. This is the information that you put on the system is what we are going to use, or the system is going to use, to verify that you are indeed a dentist that is duly registered with the HPCSA. So it's important that members put the right HPCSA number, because I tell you what, I have had to deal with some dentists who cannot, or who make mistake when they put the HPCSA registration number. So that the system does not reject you, make sure you put the correct one. If you are going to ask your receptionist to do this on your behalf, please check that the information the receptionist has put for you is correct. Thank you so much. And then, yes, Dr. Pabu, talk to us about the voucher, because some people have been phoning the office and say, please generate the voucher for me. When do we supposed to get the voucher? And maybe also deal with the voucher sometimes says, go to this hospital, yet SADA is saying, go to this hospital. Can you deal with that for us?
Thank you, Casey. So firstly, once you have registered on if you have registered previously on the EVDS portal, some of you will have received a voucher code. If you have received that voucher code, when you register on the V4HCW portal, please enter that voucher code when they ask you for the voucher code. Some of you may have not received any voucher code. If that is the case, please just leave that slot blank, and then continue with your registration process. When you register, it will not preclude you from registering because you've not entered a voucher code, and you will be provided with a voucher code in due course. So please don't stress about that. You will receive a voucher code, and then you will take that voucher code when you present for vaccination. We are aware that there have been some incorrect SMSs that have been going out, giving specific vaccination venues or times as well. Please ignore those messages. The only communication you will receive now is either from SADA or from the V4HCW portal, and that will give you your specific date and time once you have completed the registration process and when we have further information on that. So please use your existing voucher codes or use the one that you will be provided with in due course when you present for your vaccination.
So, Dr. Pabu, what I'm hearing you saying is that if you have registered on the government website and you have generated the voucher, when you register on this system, the V4HCW, you must enter that voucher. If you have not generated a voucher, leave that space blank and continue with your registration. But you don't necessarily have to go back on the government website to create a voucher. Through this system, you will get a voucher automatically sent to you?
Yes, that's correct. That's correct, Casey. If you have received a voucher previously, that voucher does not expire. So you can use that same voucher when you register for V4HCW, but do not stress if you have not received a voucher, you will receive one, and it will not prevent your registration if you leave that voucher code blank.
Thank you. I saw a comment that came from a member that is watching us, saying that trial or not trial, the dentist should have been included, just like the medics have been included. I want to say categorically so that people also understand, because I got a call that says all doctors have been included in the trial and they've received vaccine. That is not true. Before I get to Pankaj, Ntabiseng, do you want to speak about the numbers that were actually allocated and the numbers that were finally allocated, so that there is a perspective of what has happened? Because people make a mistake of understanding the numbers and only reading what their colleagues are saying. Can you talk about the numbers of the trial?
Okay. We may not know exactly the number of GPs that are in the country, but there's far more than what they were allocated. So it is not true to say that all GPs were allocated during the trial. The exact number that GPs were given, and this is private GPs, the exact number that they were given was 5,000 vaccines at the ultimate end. And that was not even near enough to cover the number. That is probably the number of dentists that we have in the country. So it was not even enough to cover the number of GPs that are in the country. So it is absolutely not true to say that all GPs were covered during the trial stage. Like we said, in a trial, you have to choose a sample. You cannot take the entire population.
The one thing that I agree with the comment is that indeed, all our dentists and all our hygienists and oral hygienists, therapists, dental assistants, they are at risk. In actual fact, our profession is at high risk, and they should always be on the top of the list for every vaccination that occurs in the country. We fully agree. And this is what we've been trying to do in the background. I want to go to Mr. G. Mr. G, I received a call the other day. It says, I am going to be vaccinated through the process that SADA has embarked on. Casey, can you please ensure you tell the minister if my family can also be vaccinated, which was my wife, who is not a dentist and does not work in the oral health space, also my children, because it makes no sense that I get vaccinated, but they don't get vaccinated. What would be your answer?
Thank you, CEO. As the government has announced previously as well, with the first batch of vaccinations, it was made very, very clear that it was meant for a certain sample group of healthcare practitioners. The actual phase rollout of ordinary citizens that are non-clinical and non-healthcare workers will be vaccinated in due course. So this vaccination rollout is a trial phase, and it is not meant for non-clinical individuals and only for clinical individuals. Thank you.
Can I maybe ask you, I can answer this question before you step off there. I also received another inquiry that says, why doesn't SADA procure the vaccines and then ask all the dentists to come and receive the vaccine at the head office in Parktown, Johannesburg? What would you say, PG?
Well, as members will have no doubt noted, or the profession will have no doubt noted, the government announced that it was taking sole responsibility for the vaccine rollout. So it is not possible for any private organization or private entity other than the government to secure the vaccines. It also becomes a very big logistical nightmare for an association that is actually a non-profit organization to be able to purchase the vaccine at a dollar-rand exchange rate, to store that at under specific conditions, and also to distribute it under very specific conditions. Furthermore, the association is not qualified to actually administer the vaccines. And may I also add, Casey, that SADA has taken the financial responsibility to actually fund the registration portal facilities to make it available for dentists, which was previously only reserved for the general practitioners. So the V4HCW portal is now going to be open for the dental profession.
Thank you very much. Thank you very much. I know someone may have seen this news flash on IOL that says, state admit that private sector can procure its own COVID-19 vaccine. This is according to AfriForum and Solidarity. We haven't looked at the veracity of that and what that means, but as it stands, everyone knows that no private sector a unit, organization, company is allowed to procure the vaccines. So it was out of our scope. But as you say, it's actually a very costly exercise to procure that, to bring it back. But what we will do as an organization is to ensure that all dentists, all therapists, all hygienists, all dental assistants who wish to be vaccinated, because I think we must emphasize that those who wish to be vaccinated, they will be vaccinated during and within the phase 1 of the rollout of the vaccine. So we have this current opportunity. Take care of that current opportunity. Dr. Metsing, do you want to add something?
Yes, Casey, I just want to add, in line with the procurement of vaccines, we've also sent out a link to members, encouraging them to register for the course that is given for members to become vaccinators. In that way, you are able to volunteer at any site. It's a 7-module course. You need to achieve 50% in all your modules for you to be certificated. It will be for CPD. You will receive your CPD points for it. So members can go on the Knowledge Hub. It's one of the links that we have shared in our previous SADA rights to attend this course and actually become a certified vaccinator, so that when the time comes, especially in phase 2 and phase 3, where the health system is going to be so inundated with the number of people that they're going to run out of vaccinators, dentists are able to also raise their hands to say they are ready with the necessary requirements to become vaccinators at the sites.
Thank you. I'm going to deal with maybe Nthabseng and Dr. Nthabseng and Tinesha, you can deal with this. Someone says, and they mentioned this at V4H4 site has no option for a dentist. Only an MP number is catered for, no DP number. Does anyone want to deal with that?
Okay, Casey, okay, it's fine, Tinesha.
Okay, so we have in the SADA right that has gone out now, we have attached a link, and when members click on that link, you will be requested to enter your DP number there. It might be that this specific member is going onto the V4HCW website and registering on that platform, but I'd like to request that they register on the specific link that we have sent out, because that link is specific to dental professionals only, and that will ensure that it will ask you for your DP number as well.
Thank you. So YT, please note, follow the new link that we have given, which is updated. It has come through the satellite about maybe 40 minutes ago. That link is the one that you must use. I also had received this comment, I think, from Dr. Mandalay yesterday. So I hope she will be happy to note that now she can put in the information as she wishes. And Tafsing, is that an old hand?
Oh, yes, it's an old hand, Casey.
Now, Dr. Raisa Mahomet, what about our colleagues in the public sector? Why didn't you include both? Tafsing, do you want to deal with this?
Okay, the public sector, this is how the government has structured it. The public sector will be taken care of by the particular hospital that they are working at. And according to the program or the plan that was highlighted and given to SADA, dentists are actually top of that list. So any dentist that is in any public hospital, please make contact with your facilitator in your hospital, and also go on the V4HC, on the EVDS website to register. Then you will be given the correct procedure to follow. But the public employees are taken care of by their hospitals or clinics that they are working at.
Thank you. Mr. G, I see you want to say something?
Yes, Casey. Just to remind members that in next week's vaccine rollout program, that members who have registered on the system, we as an association have no control over the distribution and the numbers for each of the vaccination sites that are going to be where members will be redirected to. In addition, there may be sites that are further away from an individual practitioner's practice. We have no control over that, so it may require the profession to actually travel to the site. We also impress upon the profession that when they are allocated a time and a slot, to try and not miss that for personal and professional reasons. And because the slots cannot be moved, or a separate different slot be allocated to members, and therefore they are encouraged to meet those requirements. Thank you, Casey.
Thank you very much. Dr. Pabu?
Thank you, Casey. Just on that point that Dr. Metsing raised about members registering to become vaccinators, we have received a large number of calls at the office regarding where members will be eligible to provide vaccinations. I just want to clarify with members, you don't necessarily have to volunteer your practice as a vaccination site. If you do volunteer your practice, there are a few stringent requirements that you need to meet in terms of cold storage for the vaccines, as well as having a certain space available for your patients to wait in after the vaccination has taken place, as well as a number of emergency protocols that you would need to follow should there be an adverse outcome following one of the vaccines. So it might be easier in the sense that members can complete the vaccination training and then volunteer their times at a specific government allocated vaccination site where they can go administer vaccines and not have to incur the cost of the cold storage as well as the emergency drugs when it comes to vaccination.
Thank you very much. So I'm hoping that this information as it stands at the moment helps. What I do want to implore the members of the profession is that they must not allow emotions to overtake and overcome them and join a bus, a bandwagon of criticizing SADA, criticizing everyone else, without understanding the process, without understanding what is happening on the ground, without understanding what has been achieved and what has not been achieved. And I want to emphasize, there is not a single healthcare worker that is going to go unvaccinated in the rollout phase 1, should they wish to be vaccinated. Everyone will be included. It looks like people are clamoring to ensure that in the limited available vaccine, everyone is vaccinated. It's not going to happen. But we are privileged, and we thank everyone that has worked around the clock to ensure that we have this dispensation that's going to happen next week. But you need to follow our process. Please remember, this does not replace the government portal. You still need to register on the government portal. This is only to help us with the special dispensation, critically important. So for those that are listening and those that will listen after the fact, ensure that yourself and all your clinical and support staff are registered on the government EVDS. That is critically important. Only people that have got that are registered, they will actually be vaccinated. So this is critical that you ensure that you have done that. Tell your colleagues, make sure your staff are there, check the information, check their telephone numbers, update it if it needs to be updated, because communication will be by SMS. You will be allocated a day sometimes, because we don't know what happens. It's so dynamic. It could be that you get a notification in the afternoon to tell you that you need to go there first thing in the morning. Now, if your phone number has changed or is captured incorrectly, you may have issues. So we encourage people to make sure that they register, and they register their data accurately. I'm going to now take just an easy step before we go towards conclusion. Just some of the other calls that you may have received, the staff may have received on what we should be doing and how we respond to it. Anyone can go and just tell me what other stuff have you received in terms of communication?
Casey, I think,
okay, let's start with, I'm going to start Pankaj, Dr. Pabu, and then Dr. Metin. Pankaj?
I think one of the most frequent calls that we have received is a criticism from the dental profession to say why they have been excluded and medical GPs included in the first round, and that they are equally at risk as the medical GPs. But I would argue that the medical GPs have to see every patient that presents themselves at their practice, whereas a dental practitioner is able to pre-screen the patients that present themselves and also delay the treatment of those patients who present with symptoms. The dental profession is also, I think, the best equipped of all healthcare practitioners to be practicing infection control, proper infection control, and also protection for themselves and their staff. And therefore, unlike the medical practitioner who has to deal with patients presenting with certain ailments or even conditions that mimic the COVID-19 virus, are obliged to deal and then refer those patients to appropriate facilities. And that is probably the reason why the medical GPs were selected first. The dental profession, we would still urge them to follow the necessary SADA protocols on COVID-19 and observe those protocols for the time being until the vaccine rollout is completed for the entire population. Thank you.
So regardless of what Pankaj has said, very true. But in the background, we have worked so hard to ensure that we are included even in this phase. And this is why you saw what happened last week with the 200 dentists that vaccines that were available at Steve Biko, and now this big tranche that we will be able to we secure for the dentists for next week. So regardless of what Pankaj has said, we've been working very, very hard in the background. And many people don't understand what goes behind the scenes, and they're very quick to criticize. It's very unfortunate, very, very unfortunate. I feel very sometimes it hurts to see members of the profession say the things that they say on Facebook. And these are people that have not even picked up a phone and called me, called Dr. Metsing, called Pankaj, called Dr. Pabu. And we appreciate those people that call us, by the way, because we are able to explain certain things. But there are members that don't even bother. They go online, they support statements that are inflammatory, they put statements that are inflammatory, statements that are in actual fact misdirected. And I look at some of the comments on these WhatsApp groups that I get sent on some Facebook, and I go like, is this coming from a dentist? Because surely it looks like it comes from a person who is misinformed, and sometimes comes from a very highly emotional and inflamed person. I pray and I ask members, if you're a member of SADA, even if you're not a member of SADA, when it comes to this type of things, we will assist you. By the way, before I even go forward, if you're not a member of SADA, I implore you to ensure that you still register yourself to be a member of SADA. We still are open for registration for membership. And our membership fees for 2021 have been reduced by nearly 40%, 43% if I remember, 43% from what it was. And you get all of the benefits at SADA. And like in the past where you had to choose and have add-ons. This time there's only one membership category per type, and you get all of the benefits. So if you're not a member, I implore you to ensure that you become a member. You will see in the coming few months why it is critical to be a member. In actual fact, it's going to be more expensive for non-members of SADA to actually acquire their CPD going forward. And because of the payments method that's going to happen and certain requirements, I'm telling you now, ensure that you register as a SADA member. For those members that have not yet paid their renewal membership, I implore you to do that. As we go into the future, we will not be catering for every member of the profession. There are times when it calls upon me as a CEO to make a decision to only assist those members that are members of SADA, those who pay their fees that allows us to do the negotiations that we do. And quite a few things are coming in this year. So I implore you to make sure that you either have renewed your membership or you join in as a member. You don't need you just go online, say join SADA, you complete the form, everything you can do online. You will be able to make your payment online, get your invoice online, use your credit card, use Pick and Pay, Checkers, use all of the various platforms of payment. So please, I implore you. But what I wanted to say is this. If you're a SADA member and you have this issue, it's better for you to address issues to us as an organization instead of you going out there making comments that makes you look like you are uninformed. If you go back to our satellite from January, we have been very clear in terms of the information that we've been giving. And if anyone has been following that, you should be able to see what that information is. I see Dr. Carsten says, I see no link anywhere to the V4HCW site in any satellite publication. Dr. Carsten, this has been sent to you in the satellite this afternoon. I think it's about an hour ago. So that's the satellite that has got a link. It definitely has got two links. Right at the bottom, it's got steps and it's got a link that says register here, then the last link, and then it tells you what to do. Then the last link says, if you want to continue to get information about the vaccine, please register here as well. So if you have not received that, please can you send an email to marketing@sada.co.za and we will forward you that. Alternatively, I think it's just send at marketing@sada.co.za and we will try. Let me ask if Norma is listening. If Norma can maybe just put the link on the chart as we continue with this so that members can see it. Thank you so much. Let me get to, I think only Pangaj spoke. Let me go to Dr. Pabu.
Thank you, Casey. Just two things that I would like to address. The first, a lot of queries we receive, they center around people not being able to make their specific allocated times for the vaccine. So we do understand that it is short notice that is provided. However, please try to ensure that you present at your vaccination site at the allotted time. Even if you have a theatre case booked or a full day of patients booked, please make provision to appear at that vaccination site, because if you do not, unfortunately, your allocated vaccine might be forfeited to somebody else. So please make sure that you cancel your day or cancel your theatre booking, whatever it may be, in order to appear at the vaccination site for your allocated vaccine. And the second item that I'd like to raise is that SADA is personally responsible for the funding of the registration of this vaccine allocation. So we are responsible for the funding of the vaccine, the V4HCW portal, and we are doing this on behalf of SADA and non-SADA members. So our mainstay is to ensure that all dentists in the country are going to be vaccinated along this vein. We are not differentiating between SADA members and non-SADA members. So I'd like for the public to perhaps recognize that fact, that it is not a small financial undertaking on our part. It is quite a huge financial expense, but SADA is bearing this expense in order to ensure the well-being of all the dentists in the country.
Thank you so much. And Tabiseng, Dr. Metin?
Casey, I just want to highlight to members, one thing that we noticed when we were at the Steve Biko site is that things can change so rapidly. You might have an appointment for 1 o'clock and then you are told on the spot that it is 3 o'clock or something like that. We are pleading with members to just be patient and just understand that it is not through anybody's mistake or anybody's lack of doing their work. It is just how the process has just unfolded at that time. We are not saying that these things will happen all the time, but members tend to get very upset. But if you really, really want your vaccine, please just be patient and just go with the process. We will have SADA representatives at all we will try to have SADA representatives at all the sites. So if there are any problems, they will address those problems that are happening at that particular site. So just bear in mind that things can change so rapidly, but at the end of the day, what we saw at Steve Biko is, at the end of the day, even if processes and procedures might change, at the end of the day, members do receive their vaccine, and that is the important thing.
I would like to emphasize this. Please, when you go to this site, do not be dogmatic as to what is going to happen or what should happen at the site. So I don't think we must say processes may change. I want to say processes are bound to change. So please, if it changes for whatever reason, there's no need to panic. There's no need to swear at the team that is doing the vaccination. Just understand. Logistically, our attempt will be to have a representative or representatives of the branch at each vaccination site who will be fully briefed on what to do, to welcome you and to assist you wherever it's necessary. For that matter, we are going to be communicating with the branch presidents this afternoon, and hopefully we will have the numbers and we will advertise and say these are the people that will be at the various sites when we know the dates. So thank you so much for that. I think I'm looking around and see if there's any further questions or comments. I understand people are phoning the office with many queries. I was hoping to see the questions, but I don't see the questions. With that in mind, I will just ask you to round up everything, and then we can go to conclusion, starting with Pankaj, your last words.
Yes, just to inform the profession that the resources are not unlimited, so it's on a first come, first served basis. register as soon as possible. And I see the link has been posted on the YouTube as well. And therefore register between now and tomorrow and by no later than the weekend. So it's on a first come, first serve basis. And once the vaccines have been exhausted, we cannot assist any further. I mean, we have no control over the quantities of the vaccines. Thank you.
I know with that, on first come, first serve basis, some members are going to ask me to start to prioritize people with comorbidities and this and this. Unfortunately, at this stage, the time is of essence, and the system does not allow us to do that. So please, can we then just go online? Tell, if you have received the satellite or you are listening to us now, tell your colleagues, tell them to please go on their emails, look at the satellite that I've just released about an hour ago, or if they don't have it, forward it to them. It doesn't matter whether they are SADA members for now or non-SADA members. We are doing this for the whole of the profession. So please assist, distribute widely as possible. Send messages to your friends. Let everyone receive it. I see Dr. Mohammed calls to SADA on 18 and 23rd, answered by two different dentists who said they could not help with appointments. No information early enough. That's the frustration of many. Okay, please be on the lookout for the information. Let me explain. We do not make appointments for individual dentists, unfortunately. We are not allowed to do that, and we cannot do that. However, we will inform you. You will get informed either through the system or through SADA to say you've been allocated to this particular hospital on a particular day. So you need to keep on looking at those two communications. You may be asked to do a particular action or booking, whatever the case may be, but you need to do it. We cannot book for the dentist, unfortunately. So I do apologize if this did not sit well with you. This is the reason why on the day we said we had 200 odd vaccine available at Steve Biko, and we wanted 200 on a first come, first serve basis. And we did receive those. So thank you very much for those who responded. And we just sent the list through to the hospital as we have been asked by government to do. Dr. Pabu, your last words?
I just want to make a comment. When we were administering some of the vaccines last week at Steve Biko, we did notice that certain members had registered and they had brought other members along with them who had not registered. So I just want to emphasize and encourage people, please make sure that you distribute the message to all your colleagues and make sure that each person registers individually, not just one person registering and 3 people then coming to the vaccination site. It is very important that each person with the individual DP number and ID number registers on the V4HCW portal so that each person can receive their own individual voucher code and they can each get their own vaccination.
Thank you so much. Did we lose Dr. Metzing?
Yes, we did.
Okay, I will then highlight the following while Dr. Metzing is away, is that in terms of the registration, what Dr. Pabu has indicated is important. But let's look at the things that you may need to go there with in case. First, you will need a voucher. Let me repeat what we said. For next week, you're going to need a voucher. If you already have a voucher that was generated through the EVDS system, you will put that number of the voucher on this system. And through this system, you will be allocated a particular hospital. That voucher, although it may have said you are allocated to hospital B, when you get a communication from the V4HCW system saying that you must go to hospital C, you must go to hospital C with a copy of your voucher, copy of your ID, as well as your confirmation of your membership with the HPCSA. These 3 documents are critically important. Did I miss anything, Dr. Pabu?
No, that is
Yeah.
correct. And also to members, they can obtain the HPCSA confirmation online at the HPCSA practitioner portal. It is merely a document that they can download. You can keep it on your phone and you can bring it with you to the vaccination site.
Critically important, critically important. If you have not generated your voucher, we emphasize, by the time you register today on the system, ensure you don't have to worry, skip that. You will, an automatic generation of a voucher will be done later on and it will be sent to you, so don't worry. But if you've registered, keep that voucher, use the voucher number and keep that voucher as a copy. Critically important. Guys, please do not bring people that have not registered. Do not bring people that are not on the system. That will just serve to exacerbate everyone else. I believe there's going to be an email that will be distributed to indicate if you've got questions specifically about vaccines, here's the email that you can send your questions and we can deal with those questions. Please, again, be on the lookout from the communication coming from head office. I would like to think that there are no further questions. Let me see if there's any questions online. Okay, noted. I don't see the questions. All right, I don't see any further questions. I would like to then complete this particular information sharing. Hopefully it allays some of the fears and it clarifies. Please, if there is any confusion out there with regards to the numbers, we are going to, as I said, please withdraw the number of the 3,000. That was not supposed to go out with that. But we will again send a corrective message very soon. Thank you very much. And I want to say thanks to Dr. Meting, to Dr. Pabu, as well as Dr. Gavin. We'll give you the title. Mr. Gavin, thank you so much. And thank you to those who managed to listen to us on a short notice. God bless you.